And we're here with Alex Tarnava, who's the CEO of DrinkHRW and the inventor of hydrogen tablets. Alex, welcome to the Optimal Performance Podcast.
Glad to be here. Thanks for having me.
So before we turn the mics on, we realized that we know a lot of people, people who have been listening since the Ryan Muncie days will know Ryan, and people who have bought and purchased Natural Stacks products may be familiar with the hydrogen tablets from Stacks Day offerings. This is cool. Like, this is our first time meeting together, but we kind of have been running parallel. So it's nice to meet you.
Yeah, likewise. Yeah.
I think I want to start. I want to start at the very beginning, which is how on earth did you get to invent something as unique as a hydrogen tablet?
All right. Do you want the long or the short or the middle?
Give me the middle.
Okay. So basically, I was, an amateur competitive athlete, 6, 7 years ago. Kind of in the prime of my athletic condition. I was training 6+ hours a day between martial arts and CrossFit, and then my own little side trainings. And basically I developed osteoarthritis in my left shoulder rapidly, abruptly, and that was a consequence of getting sick. And they don't know what caused me to get sick, but I was really sick for weeks, like sudden onset narcolepsy. I had like something like 70 times higher C-reactive proteins than in a healthy individual, right? I was like severely anemic despite eating tons of red meat and like, dark green vegetables and everything. It was really, really bizarre. And my best friend and roommate at the time was similarly sick. He was also a guy that, top 10 to triathlon, Spartan races, stuff like that. And he was off work for like 3 weeks with pneumonia and had to go to the hospital a couple times. So something took us down, and it took us both down hard and in different ways. And when the dust settled, I just all of a sudden was better in the period of a few days from one blood test to the other. But within a couple weeks after that, my shoulder was in intense pain. And x-rays showed that just in a short period, I developed osteoarthritis. So at that time, I was, using, traditional treatments. I was getting injections, cortisone injections. I was taking like 1,000 milligrams of naproxen a day. But I knew those weren't long-term solutions, and I was just scouring PubMed for anything that could regulate the inflammatory response. Hydrogen came up, and I bought this machine that cost like $5,000 to make hydrogen water. Um, well, that machine didn't work because when I basically developed ulcers from all the naproxen and started fainting in the gym, a few times in 1 week. And when I stopped, my shoulder froze completely. And that kind of annoyed me because I just spent $5,000 on this machine that I thought was, helping. And it obviously wasn't. And I was scouring PubMed again, and I saw more and more studies coming up using molecular hydrogen. And that really pissed me off. But then when I started reading more of the methods and looking like at the doses and durations and everything, I'm like, well, what dose am I getting? Because the sales reps never told me, and I didn't even really think about it at the time. So I ended up sort of testing the water in the machine, and it was like not detectable, right? I actually had to triple the input to detect, you know, zero point 0.1 parts per million of hydrogen in the water. So it was like 0.03, ppm of hydrogen. And, the minimum dose ever observed to be effective is like 0.5, right? So it's like 15 times higher. And our tablets deliver about 12, right? So it's, you know, exponentially lower than what we know to be effective now. So basically, the machine was a big paperweight, a piece of garbage, right? And because they never told me the dosage, I couldn't get a refund. They're like, well, it is elevated, so it's just kind of a scam. Well, I started looking for other options and, finding various products that used magnesium, like magnesium rods and all this stuff. And um, I still wasn't getting very good levels. I was getting like zero point 0.4, zero point 0.5 ppm, and I started experimenting my own, kitchen, and I was able to get some of these products up towards like 2, even 3, parts per million with pretty extreme modifications, and you know doing things that were causing thermoses to explode in my fridge and damage things, right? Like from building up too much pressure. And on top of that, these companies were really, really shady at the time. Like I already didn't want to support them because um, they were making claims about like curing cancer and all this stuff. It was like really, you know, it was when the industry was super embryonic and there was all these shady players, you know, making products that were no good. And it gets even deeper. Like, when I got into the industry, I started testing some of these products. They're high in heavy metals, all this stuff, people making, you know, tablets not like mine. I'm the only one who's figured out how to make it like an open vessel so you can just drop and drink. But other people had made tablets that you either swallow, which is an exothermic reaction in your stomach. It can be potentially hazardous, cause ulcers, potentially things like that. Others make ones that you have to seal in a bottle and wait a day for it to build up and make hydrogen. Um, some of the reports I've found, like the testing I've done, they've had like abnormally high heavy metals, like potentially like definitely violating California laws, for instance. Um, then word of mouth stories I've heard, like, they didn't know how to get the legal approval to use a magnesium. So they're buying off like, third hand retailers of like, fireworks manufacturers and stuff, like never intended to be used in food. Anyways, that's this. um, these companies were super shady, and some of them were even soliciting me to like join their MLMs. Like I'm buying as a customer and I'm getting phone calls because these companies have given my information, to their downlines to try and recruit me. And I'm like, you know what? I want no part, of these people or to support their business. Um, so I just started it as a do-it-yourself project, and um, halfway through getting it down, I thought to myself, I understand this stuff well enough, but I want to make sure I'm not, a Darwin Award winner, and magnesium metal and hydrogen are both explosive, right? So I want to make sure I'm not blowing myself up in my kitchen. And I found my founding partner, Dr. Holland. He's a PhD chemist from the pharmaceutical industry. Runs a team for you know um, for a large pharmaceutical company. So at first he told me it was the worst pseudoscience he'd ever heard in his life, but after I kept on sending him more and more research on it, showing him kind of like the results, he said, "Wow, there might be something to this." And he started reviewing what I was doing. We went back and forth. We got a working prototype in like 3 weeks. Um, then scaling up and like making, producing was a real challenge, because as soon as we had to modify formulas to get it to run on a machine, make millions instead of just make 10, with a little hand press and a mortar and pestle, it went from taking 3 weeks to a couple thousand iterative adjustments and 15 failed scale up attempts over more than a year until we got our first production ready tablet. So
Wow.
by that time we'd put so much in, we're like, we gotta commercialize.
Oh my gosh. All right, cool. So many side questions. So you were so committed. Something about the concept of hydrogen and water was so resonant with you.
Sorry, I forgot that part. When
Yeah.
I started like rigging up these solutions that were exploding in my fridge, my shoulder unfroze. So
Oh,
I was getting kind of like the 3 ppm, and I was drinking like 2-3 liters of this stuff a day, chugging it down. And
wow.
my shoulder unfroze in like a week, right?
Wow.
So that was kind of like the proof of concept. Like
There we
it
go.
worked. Like it went from I couldn't put on a shirt properly because my shoulder was full blown frozen to like I couldn't go back to compete anymore, but like my pain was down, I was sleeping better, yeah, my shoulder loosened up. So I'm like, man, like this stuff worked, and it worked quickly for me, right? Nobody else is doing this ethically, and that's kind of what drove me to get it done.
Yeah. I love this, man. This is like the classic N of one biohacker finds a solution, tinkers around. Nobody's got the right answers. And then you say, fuck it, I'm just going to do it myself. I'll figure out how to do it right. But I'm fascinated by, because I think a lot of the listeners will be familiar with the purported benefits of hydrogen water. I think a lot of people have heard of it and the different manufacturers and seen like the beautiful, swirling tech and the demonstrations. We won't name any names, of course, but unless you want to. But
Yeah,
you were,
I mean, I make for about 50 brands too, right? So I've got my company, right, and I make different types of tablets for about 50 different brands in the market. Some have me on their podcasts or mention me by name. Others don't, and they try and claim themselves their own manufacturer. So I can't say who's who, right? But
yeah.
basically, my manufacturing arm is the only company, in the United States that has legal status with the FDA. So
Hmm.
we're in a really, really small group. Only about 4% of companies required to have new dietary ingredient status with the FDA have actually done it.
Hmm.
And those are industry and FDA estimates. Most people just market illegally without proof of safety, anything like that. So we spent, years putting together a comprehensive report that we filed to the FDA demonstrating our justification, how we're compliant for safety, every law, in manufacturing, and did this. And this is really, really important. Um, a lot of people end up thinking that there's some sort of conspiracy because as soon as ingredients are shown to be working, the FDA sometimes shuts them down, right? And this is actually written into law, and it's the negligence of the supplement industry as to
Hmm.
why this happens, right? If something is investigated as an investigational new drug, and if US researchers start clinical trials on an ingredient, right, they have to, for a disease purpose, they have to file something called an IND, an investigational new drug application, right, just to get the clinical trial started. So all these supplement manufacturers, like ingredient manufacturers that have potentially beneficial ingredients, they don't do their due diligence and file as a new dietary ingredient or file as generally regarded as safe. But that loophole for grass-fed supplements closed a few years ago. It has to be an NDI now, meaning as soon as researchers or a drug company or anyone files as an investigational new drug, it becomes illegal to market as a supplement. So it's no conspiracy, it's just negligence, right? However, conversely, if you file an NDI and you're on record as a new dietary ingredient, right? Even if you file INDs, you could file 1,000 INDs after the fact, and it remains legal to market as a supplement forever. You can't make drug claims on it, right? But you could pursue any drug avenue you want and continue to legally sell as a supplement, right? It just took a few years, cost me a few $100,000, right, to do, but I forever protected my technology. We can always sell as a supplement. We can go down the drug route if we want. Nothing is preventing us from doing that. And, you know, we have a lot of clinical trials and preclinical research programs that are going down drug exploration. Like we're not full steam pursuing that at this time, but, even on top of, um, the 7 clinical trials and 3 case studies that we have published, we have multiple clinical trials underway, some of them in the United States, for disease purposes. Our biggest trial underway right now that we just had, some press about is a phase 3 clinical trial for reducing hospitalizations in COVID-19, in the 60 plus population, and that's
Wow.
being done in France right now.
Wow.
We actually have 3 clinical trials underway regarding COVID-19 right
Huh.
now. We have, a clinical trial. We have, I think, 4 or 5 clinical trials being done, out of Stony Brook in New York right now. One's post-stroke recovery that's been underway for a couple of years. They actually published a preclinical trial showing the benefit there, in rats doing the same treatment after like a simulated stroke. We have one for Parkinson's disease at Stony Brook. We have another one to reduce side effects and improve outcomes in cancer patients on radiation and chemo.
Wow.
So we've got like a lot of serious research on disease models. We'll never be able to market it unless we go down the drug route there. That's just how the laws work.
Sure.
But we're happy to support public researchers because none of this is funded, by us to try and push it as a drug. These
Right.
are all research teams that are saying, like, public universities and hospitals are contacting us and saying, we think this can benefit people.
Hmm.
Will you support us? And that's part of our truth and transparency policy, that we
Yeah.
don't really believe in privately funded research. I'm actually writing a
Yeah.
book right now called it's basically on the deterioration of information in our
Yes, buddy.
and it talks a little bit about, I mean, everyone's watched like you know um documentaries like The Social Dilemma, see like things like that. We know about the news, but there's the other angles that people don't talk about, like, even from a marketing perspective,
Sure.
how marketing teams, how data of marketing companies, how publicists, all of
Oh
these
yeah.
influence everything. I mean, I had one publicist get an article approved by me in a major publication, but they wrote the article and said, no, you can't change it. It's accepted as is. So I pulled it, and I didn't want it in there because it basically said, you know, that I would had exhibited extreme confidence in my own ability and mission, which isn't true. That's why I surround myself with experts, right? Because I'm searching for truth, right? I don't know what I know and trying to prove it. I'm trying to find the truth, and the truth is, leading me. And I realize that we live in a world where you need experts in every avenue, right?
Yeah.
That's the whole concept of Dunning-Kruger, right? You can't know everything all the
Yeah.
time. And then they added that I was, grounded. This confidence came from my deep faith in God, and I'm not religious. And we feel the demographic, would like this angle. It's approved as is. You can either accept
Whoa.
or reject it. So I rejected it because it just wasn't right, and it
Yeah.
was free publicity in a major publication, but it just wasn't the right thing to do.
Wow.
So I see little things like this every day,
Sure.
right? Marketing teams, publicists wanting to tweak my quote, wanting to write my quotes for me, do all this stuff, and I won't do it. But
Yeah.
how companies do, and how does that change our information, right? Then we get into, you know, we get into say how science works, right? And how academic publishing works and all this stuff. And I wrote, I think it was like 14,000 words, and kind of the flaws in the peer review process and scientific publishing and scientific funding. This is going to be a chapter of my book. I'm going to probably double the word count in that section. I've been working on it for about a year and a half now, and I'm running some of my own studies that are going to be pretty large data sets to gather this. But at every avenue, truth is deteriorating, right?
Hmm.
So it's incredibly hard. And I don't believe this is any sort of conspiracy. I just think it's human nature,
Sure.
right?
Interesting.
Everyone wants to do their task. You know, the people say on marketing teams that are saying, oh, you should tweak this, and they're going off data. They're looking to do their job as good as they can, right?
Sure.
Publicists
Sure.
wanting to change things is wanting you to get as good of media as you can.
Yeah.
Everyone is looking to do their job as best they can, which means, nobody can see the forest through the trees, right?
Yeah.
Nobody can see the bigger picture because they're so focused on their task. And the same sort of things end up happening in science and academic publishing, right?
So it's an organizational failure rather
Of
than
humanity,
of
right?
humanity.
Yeah.
I want to keep going in this because this is super fascinating. I did not expect to go here. A couple of things that are really striking to me. Number one, and I still want to go back to the properties of.
And I really digress because I was going like into we support public research, and
It's good.
I
No,
don't have money, and I don't sign an agreement. We don't have control over protocol. We don't have to agree to publish. The results get published no matter what.
yeah,
That's one of the big flaws I see in science,
yeah,
right? Is how it can get controlled. And I've been thinking a long time about solutions on some of these things, how
yeah.
to keep costs down. I mean, just for instance, like public teams that have gotten quotes from me to do in research that I'm interested in, that they're interested in too, are usually about 10% or less the cost as when I've contacted contract research organizations, right?
Ah,
Because it's profit built into every level, right?
Right.
Not only is that research more flawed, but it's profit at every level. And then we wonder why it costs $1 to $3 billion to get a drug to market, because
Sure.
they're CROs from start to finish. Well, what if that was 100 million, to 300 million? Well, then our cost of drugs, our cost of insurance would be a fraction of the rate,
Right.
and we might have more honest outcomes.
Yeah.
That's what's going on.
Fascinating.
Mhm.
Fascinating. I, I don't remember where I saw this quote, but it was like, there are very few scientists left in the world, but there are an abundance of paid researchers. And I thought, oh, like that does sort of characterize how we get information, what's what ingredients are, what the effects are. And I think for a guy like yourself who was trying to solve an issue and researched and failed and iterated and kept going and essentially was committed to find a solution and had that moment where your shoulder unfroze. You're like, oh my God, hydrogen water actually does do a lot of amazing things. This, or I now have this experience of hydrogen, of hydrogenated water doing something for me that I wanted it to do. Um, then, then going from there to developing these products and to
And I should
growing it.
add,
Yeah.
I've handmade prototypes, right? Sat there. It would take me about an hour on the hand press to make a month's supply for people. And I was spending about 40 hours a month, you know, giving out samples to people I knew that had issues that I'd seen research that had help for. And just, none of these were legal and I wasn't selling them by any means. I
Yeah.
was giving them out to like friends and family and acquaintances
Yeah.
that, agreed and like, knew what I was working on. And the overwhelming success of those is part of what gave myself confidence to keep
Yeah.
moving. And I knew that could have been, placebo for a lot of people, but I knew for myself, like the likelihood, like, because I had tangible, like objective outcomes in terms of range of motion, right? That were night and day. It wasn't a little bit, right? So I was pretty high confidence that it wasn't only placebo at play. But then as soon as we hit market, that's when I worked as hard as I could to find, objective analysis from third-party researchers that have no financial ties to this. And that's how
Sure.
I developed our clinical outreach program. I think I'm working with 12 or 13 universities right now. We have about 15 clinical trials that are underway at various stages, 7 that are completed, multiple preclinical research programs underway. Um, and like I said, for all of these, some of them I donate to, others I don't. But in all cases, the researchers have final sign off on protocol,
Mm.
right? And final rights on decision to publish, right? And that, that's part of what I talk to, when you say that paid researchers, I mean, financing issues aren't just from the private sector, they're the public sector. The
Sure.
way that researchers get funding, right? I mean, there is no benefit to a researcher to publish null hypotheses, right? So if a research team is only publishing that things don't work, they're going to have funding problems, right? Because
Totally.
their
Totally.
research is deemed to be not impactful. Journals also don't really want to publish null findings.
Sure. Sure.
Usually they have to publish these results that something didn't work in very low impact factor journals. How some of the grants work is they look at the average impact factor and the Simon or anything like, is it Q1, Q2, Q3, Q4, and say for their grant, they have to publish X amount of papers in a Q1 or Q2 journal, right? And well, if they're trying to undermine findings and say, I don't believe this, I'm showing it doesn't work, well, they're going to be publishing in Q3, Q4 journals. So
Hmm.
not only, right, are they having no motivation to do this, they're being actively punished. And these are like often publicly funded grant dollars. So we're punishing researchers for telling the truth, right?
Sure.
And so
Right.
say they get the results and it doesn't work. Well, it might take hours or tens or dozens of hours for them to write a manuscript to format it to how a journal wants. Then the journal doesn't want to set null findings, right? They might spend a year reformatting the journal after journal to publish one paper that says something doesn't work. In the meantime, who knows? Maybe there was 30 other publications that said this thing doesn't work, right? That didn't get published because the researcher goes, I'll get around to this later. I have more important things to do. I need to get 3 more papers out in these Q1, Q2 journals to get my next round of funding, right? So there's this tremendous pressure on scientists today to basically publish or perish, right? And not only do they have to publish, but they have to publish in high impact factor journals showing beneficial results. And this completely skews how we receive and analyze information.
Yeah, it's fascinating. Yeah. Well, I can't wait to read the book because I think it's past due for insight and inquiry into this. And I think for
It's
people,
probably at best a year away. Just
hey, fair enough.
yeah.
Fair enough. Yeah, that's all good. Take your time. Don't rush it. Yeah. Case in point. But I think for people who, especially um, my listeners, people who are looking to find effective solutions to increase their health and increase their output and optimize their performance. Hearing from you, the inventor of this thing, who is so critical, taking such a critical eye at how important it is to prove and do good research and do good science.
And I've started another, there's a couple of other things I'm working on. Basically, one, I've started my own biohacking reviews for popular devices and everything. And, my marketing team and investors say, we'd make a lot more money if you found some of these things worked, right?
Yeah, right. I'm sure.
And we could like become an affiliate. I'm like, you know what? But that undermines the truth, right?
Sure.
A lot of these are really expensive devices that are pushed by some of the biggest names in biohacking.
Yeah.
Dive deep into their science, they have none. It's all bullshit. Doing studies on happy customers, right? That
Yeah.
objective outcomes, you know what I mean? And then just adding a lot of scientific sounding jargon throughout their marketing and adding a lot of references that actually aren't a citation for anything that they have or what they're doing, and then I'll run, and my wife has banned me from doing this on her now, but I'd run, blinded experiments on her, on myself, right? Or at the very least controlled. And when I'm finding, like, you know what, this did nothing for these parameters that they say it's going to help. And there's no, like lack of data. Like I'd run 30 days against 30 days exactly to their protocol and see no difference in like sleep outcomes or athletic recovery, doing blood pressure and, various measurements like immediately after it, and doing all this stuff. I'm like, okay, this device is $400 or $2,000 or something like this. And it really didn't do anything at all, right?
Yeah.
But it's endorsed by all these big names, and
Sure.
that is their generous affiliate.
I I I have to tell you how refreshing it is to have this conversation because I love biohacking gear. I love, I'm wearing a biogeometry pendant designed by Dr. Ibrahim Karim, this Egyptian friggin' genius. In my office here, I have like 30 different things from plasma generators to mood enhancing necklaces and so forth. Um, if you're open to it, I'd love to go down this rabbit hole with you and name some names. Are you open to doing that today?
Names of products. I mean, the ones I've reviewed. I mean, some of the ones I haven't reviewed a lot of. I've reviewed half a dozen, but I'm actually starting I've started it already, but we aren't live yet. A not-for-profit called MyJourney.science, right? And we have a number, of PhD MDs on it. It's slow going, especially during the pandemic. We've all had so many other obligations. But what this is going to be is a database of N1s, right? That people basically they will register their N1 as a case study, right, on our site. This is what I'm testing. This is what I'm going to do, and it's not just biohacking devices. It'll be diets, it'll be various supplements, no brand mentions, but just like ingredient, dose, that kind of thing. And it's going to keep a database of how often it works for people, right? What it's doing, does it have side effects? So many of these things We don't know if they're effective, but we also don't know if they're harmful because there isn't enough data on any of this stuff. And a lot of researchers are mining for data right now. They're looking through Reddit and Twitter and, things like that to try and track to see what people are complaining about and saying, because there just isn't enough post-marketing data on drugs, let alone, supplements that are widely unregulated. Um, so we're doing this. We're in the template writing phase. We're debating a lot of the templates back and forth because we don't want to get it wrong. Your data is only as good as what you collect, right? So if you're asking the wrong questions, if you're collecting the wrong data, then it's useless. So we're going to start adding these templates, and people will be able to do this, track their results, track their information. Then you can go and see, fasting, at 48 hours, right? Someone does that once a week, right? Does this improve their, metabolic outcomes, right? What tests did they do? And we can start getting it, right? And we can start looking into things like various biohacks and supplements, like, okay, this worked in 60% of people, right? And has no side effects, right? Now, at that time, we'd allow, basically what we'd have is people could upload their genetic reports too, if they choose to, right? That is kept confidential. But then if a research team says, this is really interesting, this seems to work in 60% of people, how much genetic data do you have, right? And if people are consenting to uploading this, and it would only be available to public researchers could go in and say, well, it looks like, people with these genetic traits or genetic, these alleles or variants or whatever, are responding or not responding to this. And then they can start doing studies. And it's going to be a not-for-profit. We're going to sell placebos, take donations, stuff like that. But all the money we raise above operating costs will be donated to these research groups who want to study things from the data we're collecting to just keep the information cycle going. Because say a genetic responder study, that could cost millions of dollars, right? But we could crowd collect a lot of basic information. I mean, hundreds of millions, if not billions of people are wearing wearable technologies every day, right? We just need to teach them the basics about how to try one thing at a time and look for outcomes, right? Because too often people go, you know what, I want to get healthier, I want to be a biohacker, I'm going to do all these 10 things at once, right?
Yeah,
And
for sure.
one thing at a time. Did this work for me, right? Because say we have all this wide evidence on hydrogen, right? But hydrogen doesn't work for every person. The data shows at best at the right dosages and concentration, it maybe has about an 80% responder rate, which is similar to things like creatine and caffeine, right? A lot of drugs might work on 30%, 40%, 50%, 80% of people. They're not going to work for everyone, and they might have side effects on a small subset of people. And this is what we're really starting to learn. We're using big data to find that we need more, independent like data, targeted to each person, right? So we're kind of coming in a circle, but we're coming back to personalized medicine, right? With big data in hand,
I love
right?
that. Oh man, I love this. I'm working with a team. It's not the same. It's complementary, I think. It's called Virtual Biohacking Assistant, and it aims to do some similar things. As the future of personal health is going to be individualized. It's going to be data driven, and it's going to be based on the metrics of diagnostic tools and blood work and stool tests and urine tests. So we know that medicine is becoming more and more remote. We know that your family doctor that you grew up seeing since you were a kid is probably not super hip on cutting edge scientific endeavors and technologies, and it's
Nor can they be.
right. And it's not a knock against them, but totally. I love this idea because most people just have nowhere to start. They go down a WebMD rabbit hole. They use Google to do research, and Google is feeding them bullshit after bullshit, and you have to sift through the bullshit to figure it out. After the Panda updates and the massive restructuring of how natural health was searched through Google.
It's not even natural health. It's pharmaceutical research, like everything has been completely, restructured. I think
Right.
it was if it wasn't last, I'm losing track of time. It was either last June or the June before, right? But I remember it was a June that it happened.
It it's different. It's changed forever. I mean, companies that your companies probably were also affected. I mean,
Yeah, I mean, we
right?
were hit hard back in December. There was a Google update back in December, and it was interesting because we were hit by this update that looks at like credibility, credentials, trustworthiness, all these things. And our SEO team just looked at it, and that's another thing I'm going to dive into in my book is SEO, because they always want to change your phrase and change it to fit into a Google phrase, because they're trying to hit these phrases that people are searching for. But changing your phrasing slightly could completely change the meaning of what you're trying to say. So sites just allow their SEO teams to run through, and now your information is wrong, right? Because an SEO optimizer changed wording slightly, and it means the same thing to them, but it might not. It might completely mean something completely different in context, right? From
Totally.
what's being written.
Yeah.
Um, but I mean, we just had to go in. It was little things like because we're talking about like health topics. We had to add every single one of our contributors is published, right? Like peer-reviewed academic publications. I'm the only one who's not a PhD or MD, so we had to do things like put full bios at the top of all of our articles with like date and update, you know, dates, right? And like photos and links to our research gates and Google Scholars and things like that, because Google just deemed us untrustworthy, right? So hopefully this 500,000 words of content we have that is all well cited, well researched, you know, overwhelmingly not controversial, at all, right? Um, Written by published individuals. Hopefully, we won't be deemed untrustworthy in the next update in like a month, but you never know with Google.
Well, yeah, it's oh man, this is there. This is this it's complex, right? Because to a certain extent, there's a lot of people selling stuff online, consumables that shouldn't because they haven't been proven to be healthy. So there's a lot of quackery. There's a lot of unsubstantiated claims. So on that hand, I understand the most powerful the most powerful search engine on the planet wants to protect people in a certain way, make sure that they're not being pointed in direction of something that's not only ineffective, potentially unhelpful. On the other hand, we know the connection between Google and Big Pharma. We already understand where the money
So, and a lot
comes
of
from.
these sites that are trustworthy,
Yeah,
hire content writers out of like the Philippines that
right.
aren't don't have professional, training, and they basically just replicate what they've seen. Like Healthline might replicate what they saw on you know, I'm losing my train of thought, but
Yeah,
the mainstream like WebMD or something. You know what I
right.
mean? It all could be completely inaccurate and easily shown to be completely inaccurate, right?
Right.
And that's another thing how SEO works, and publicists know this, is if there's already a consensus in publications about something, even if it is factually wrong, right? The next publications want to replicate that. They might do a slight change, but they can't completely contradict all the other changes because Google's algorithm will say you're the outlier,
Right.
right? You're the outlier. We're going to punish you, right?
Right.
So I've
Well,
come into that, like, articles not understanding the difference between hydrogen gas and hydrogen ions, and they're just completely wrong. Like, don't even understand high school level chemistry on it. But because there's 10 publications saying that,
right.
the next one doesn't want to correct it because they risk having themselves punished for not being with consensus, right?
Yeah.
And it's a really dangerous system in information.
Yeah.
And again, I don't think Google is up to any conspiracy. I think they look at certain things as problems and they're trying to fix things in their algorithms to find solutions. But the problems are so nuanced, right? There's
Yeah.
problems on each side that when they make fixes, they're creating conspiracy theories and not actually fixing a large part of the problem in how we generate and assess information.
Yeah. Ooh, man, I really can't. You got to hurry up on this book, man. Don't tell me it's a year away. I want to, I can't wait to read up on it. Well, on that note, what health resources, I have the ones that I'm fond of, people, organizations that I really appreciate how they present health information. And, you can't even say natural health anymore. Now, natural health is like a bad word, or alternative health, even holistic health is like now fringe, and it's fucked up, and it makes me angry. What sources do you like?
It's tough, right? Sometimes websites really disappoint me, and sometimes they surprise me. You know what I mean? So there'll be ones that are like, okay, this is good, but all of a sudden they try and cover too many things and they become not very good, right? Or other times, uh, they're usually awful, but have one article that's really well written. So I don't really want to name any resource as
Fair enough.
this is a universal good resource. But I think the problem comes down to you can't be an expert in everything, right? And you can't even have a team on most of these sites that you can be an expert in everything. So when we're moving to this age of competing for content and information and all these things, every website is under such tremendous pressure, right? To churn out more and more content, right? To compete against everyone else, that their quality starts being diluted, right?
Sure.
Because they fall into, okay, we're going to churn out 12 to 1800 words on this topic, you know, get this person with the Bachelor of Science to write it. What's that person do? They look at four other sites and they just word it a bit differently. And, either the bulk of the information was wrong everywhere or it was right everywhere. It was half right, half wrong. And so we just get this regurgitation going on as everyone is trying to say similar things and word it differently to keep up with the never ending dissemination of just blah,
Yeah.
other
Yeah.
than saying things good. And then you get, to people who do say things really well and are writing really good articles, but then the more they write, the worse it becomes. And that was one of my fears, right? I started writing because there were topics I was passionate about, I knew a lot about, but as my team started to say, well, we need to have regular newsletter schedule, like we need to do one a
Yeah.
week, two a week. And I'm like, man, some of these I'm writing are like, you know, 10,000, 15,000, 20,000 word, 30,000 word, even like, series. So then we start splitting them apart, then it's pressure. And then it's like, I get busy on like working on a study or something, or on the business side. They're like, we don't have something for next Friday. You know
Sure.
what I mean? I'm like, man, like, so now I have to come up with an idea,
Yeah.
turn something up for next Friday.
Sure.
So I started trying to get way ahead on it, but then I just said to myself, I don't want this kind of pressure. At the same time, I know people reading will become disengaged if we don't have new things
Yeah.
to talk about every week. And that's why I started bringing in a lot of other writers, and working on topics that they were confident. I read them, review them. I want to make sure that uh, I don't have to agree with what they say, right? Because they're an expert in their field. And, if I had to agree with what they said, that kind of undermines the whole purpose of
Sure.
truth. But I do review them all to make sure nothing is like crazy controversial or egregious.
Yeah.
But we just added a large number of writers, and I still write, but um, I'm writing more like lighter stuff, like identifying scams in the hydrogen water market, like test reports, stuff that I can pay a lab to get done, or do the testing myself, record on video, and then write the content in my sleep in, an hour. Like these biohacking reviews that I have fun with, because I'm genuinely curious. And I mean, a lot of people, I've been accused of saying, oh, why are you such a hater on all these devices, by a couple of people who are in the biohacking industry. And I say, listen, I want these to work.
Yeah.
You know what I mean? Like, this
Right.
is why I'm interested. I really want this stuff to work,
Yeah.
but I'm also not going to take their word for it. Like show me
Right.
evidence and show me the results. You
Yeah.
know, that I have no benefit to show this stuff doesn't work.
Yeah, you're not
And I've already bought it. You know what I mean?
yeah, you're not making friends asking hard questions, right? Fascinating. Well, I do want to go back to the benefits of hydrogen water and the delivery system that you've really grown, because
Yeah.
I am totally new to it, and I've never tried it, and so I don't have the firsthand perspective of it. This is so fascinating. Let me just say that I really enjoy the way that this conversation has gone. It's unlike a conversation I've had in a long time, which is open and honest. And Alex, I really like your style. But I do want to talk. I do actually want to talk about the benefits of DrinkHRW. So
And as my marketing team, it starts hearing this podcast, they're gonna be like, "Oh no,
what are you
man,
doing? Yeah, like you have this amazing product that helps a ton of people. Please talk about the product.
So, basically, hydrogen itself, at first, we thought it had no purpose in our body. We produce liters of hydrogen gas a day. It's on all our cells at all times, right? But for a long, long time throughout most of history, up until about 2007, we thought it was inert. It did nothing, right? Had no function or process in the body. Well, then we started having study after study showing there were these beneficial results from hydrogen. At first, it was thought that it was a novel antioxidant, which that was one of the first stories that's shown to not be true, because in some cases it can actually be a pro-oxidant, right? It regulates the redox status within our cells. It's shown similar stuff, like in some studies it can raise inflammation, in others it can blunt inflammation. It's shown the same thing with autophagy, right? Like it's basically shown to be this regulator. But in almost all instances in the literature, now there's 111 publications as of today, March 1st, 2021, in humans with hydrogen, therapy. And there's probably about 2,000 in animals. And in almost all instances, it has regulated our functions back towards homeostasis. So kind of like harmony, right? Back to what it is. And what's really interesting is when, say, we put hydrogen on healthy cells, you know, no damage whatsoever. We just expose them to hydrogen, almost nothing, like nothing happens, right? You put hydrogen on damaged cells, and that's when you see all these markers start to change, all these corrections start happening. Additionally, when we expose, say, a mouse to hydrogen 24/7, there's no changes, no benefit is incurred, right? But even if the dose is smaller, when we give them an acute blast, we see all these changes, right? So for humans, it's actually shown we need it, and it's the same thing with mice, but you want a higher concentration and dose given intermittently, acutely. And it's this alteration in cellular concentrations for an acute period, maybe 5 minutes, 60 minutes, right? That is showing to have all these changes in cell signaling, in genetic expression. So I've started thinking about hydrogen as sort of, a supervisor, a regulator in our cells, right? Say you have a shoe factory, right? And one line is making laces, and the other is making, the tongue, and the other is making the insoles, and the other is making the line. Well, if too many laces are getting made, all of a sudden they start piling up, right? Or if not enough is made, everything else starts piling. Hydrogen is kind of like a supervisor coming in and making sure all the lines are, producing the right amount of everything. Because, people think antioxidants are good, but if you have too much antioxidants, that's not good. That's
Right.
dyshomeostasis of our redox, right? Because certain oxidative stressors and nitrosative stressors too are critical to cellular communication, right? Even think like one of the most important molecules in our body is a free radical, a nitrosative stress, nitric oxide, right? We don't want these overwhelming antioxidants. And in fact, that's why all the human research shows that high dose antioxidant therapy not only is not beneficial, but it can cause harm, right? It increases all cause mortality. It reduces, makes outcomes worse in cancer patients. It can interfere with medications like, cancer therapies, right? Well, hydrogen isn't that. And that's why I really try and correct a lot of companies that just talk about hydrogen as a powerful antioxidant. Not only is that laughable, because the reason hydrogen was a selective antioxidant, in vitro studies, so like not in the living body, is because it's so weak. It bypasses most oxidative stresses and
Huh.
only reacts with the hydroxyl radical and peroxynitrate, right?
Huh.
So it's not a powerful antioxidant. It's effective in vitro, right? Effective against the most damaging oxidative stressors. But in reality, hydrogen seems to regulate, certain, oxidative stressors like H2O2, nitrosative stressors like, nitric oxide. Our one study on hydrogen water and metabolic syndrome, it was a double-blind placebo-controlled study, 6 months and 60 people, and it reversed like basically all signs of metabolic syndrome. That was effective in 18 of 20 measured outcomes. But I think it was nitrites that were, quite significant, was one of the markers, right?
Hmm.
But there's quite a bit of preclinical research showing that hydrogen seems to regulate and, various like nitric oxide, function synthesis and such. So,
Can you think of it as like an adaptogen? Is it appropriate to think of it like that?
yeah, I mean, that really is what you want to call it. You want to be careful though, because the word adaptogen is illegal with the FDA, right? That you are not allowed to call something an adaptogen. So
Really?
I,
Like you can't, nobody can use that term?
it's yeah, the FDA has come
Jeez.
down on the word adaptogen a few
Gee
times.
whiz.
I really don't like saying that word, but
Oh, I said it.
yeah, yeah. I mean, and most adaptogens will talk about like a couple processes here and there.
Yeah.
It has seemed to be wide ranging, right? And if we go back in time, molecular hydrogen has been integral for the development of our atmosphere, for
Yeah.
life on this planet. Even our mitochondria, evolved from a hydrogen dependent organelle that utilized hydrogen as its energy source, right? Now within our body, our bacteria, some of it exhales hydrogen and some of it consumes hydrogen,
Hmm.
right? So hydrogen is so important to us throughout evolution, throughout our bacteria, which we're realizing more and more it is critical for our health, you know?
Yeah.
Um, so I think of it as even more than an adaptogen. I think hydrogen is critical for a lot of functions and how we regulate and adapt, to stress. And that's what we really see happening. And say we're healthy, 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 and then something happens and knocks us off skew. Say we're eating too much shit and the processes in our body start changing, or dealing with tremendous, physical or mental stress, so everything starts changing. Hydrogen just seems to come in when we give these blasts, right? It comes in and tweaks things back to being right. And
Awesome.
think of it sort of as the same way, and this can explain why you need this high dose intermittent blast, not just continuous. Think about exercise. If you're just constantly on your feet working out all day long, you're
Yeah.
actually going to be unhealthy, right?
Sure.
And
Right.
your hormone balance is going to be off, right? Whereas if you're always sedentary, right, you're going to be unhealthy, right? And everything goes wrong. It's that intermittent exercise where we strain ourselves for periods that helps basically reset a lot of our communication and keeps us strong and healthy. We seem to need the same thing with hydrogen. Now you go through humans evolution, right? I mean, eating various, carbohydrates, you know, the carbohydrates get broken down by bacteria and our, small intestines and produce hydrogen gas. Well, now we have this constant exposure. People usually eat the same diet all day long, every day after that. So we're getting this constant slow exposure of hydrogen. Think about us through our hunter-gatherer stage. We were starving, and then maybe we find a bunch of fruit or some grains or something, and we eat it in a big blast. So our hydrogen exposure was going to be
Hmm.
up, down, all over the map.
Yeah. Right.
And that up, down, all over the map seems to be what it is promoting these healthy outcomes.
That's so cool. Oh, those are really great examples. That really does kind of put into perspective, even from dietary, the dietary example that you just gave. So then, understanding your product and the application, because it's not just the products that you carry on drinkhrw.com are not, there's bath tablets and there's beauty products. What is the most optimal way, considering the sort of blast that you talk about? What's the best way to do the tablets?
It depends on the outcome.
Okay.
You're looking for, right? Like if you broke a toe or sprained your ankle, you're probably going to want to do it topically because you're going to get a higher, like obviously hydrogen. It's the smallest molecule in the universe, so it's transdermal, right? So if you're submerging, an injured limb or sore muscles,
Hmm.
you're going to get a higher concentration going through your skin into those muscles into that damaged area if you drink it. However, if you drink the water, right, that's going to have the biggest interaction with your microbiome, right? It's
Hmm.
go through your liver. It's probably going to have the biggest metabolic outcomes, right? So, you know, we still need to do a lot of work on knowing the perfect dose for the perfect person, you know, the perfect administration method. Should you be bathing in it for this, drinking it for that, inhaling it for this outcome, right?
Hmm.
Or a mix of all of them,
Yeah.
that's still unknown right now. But anecdotally and from research trends, it seems things like metabolic outcomes, right? It works better for hydrogen water, drinking it, whereas muscle soreness and soft tissue injury, stuff like that, topical seems to work better.
Hmm.
Inhalation, as of yet, hasn't shown to work better than hydrogen water for any outcome, right? And it needs a much higher, you know, dosage. That could be because it's actually inhaling at like 100 times the dose will raise cellular concentrations, similarly to drinking at 1/100th the dose. And then if you're inhaling, it's not interacting with your gut, right? So there's
Oh.
that changes. However, inhalation has a lot of benefits um, that it can be used on incapacitated patients,
Hmm.
patients that aren't conscious. Also, it does seem to have slightly different, pharmacokinetics between drinking and inhalation. So there
Sure.
could be situations where inhalation is better. We just don't have enough data yet.
Hmm. Fascinating. Oh my gosh. So cool. Um, Man, time has flown by here in this conversation, Alex. This has just been so interesting. Um, what do people? I mean, what do people usually say? I mean, what do about the benefits? Like, what's the most common response that you get from people? It's like, oh yeah, this is way
Our
better now.
our two most, or actually our three most common. So our most common is improved sleep, right? And we
Again,
we
back
have
to homeostasis, right?
yeah, we have multiple clinical trials that are either underway or reviewing data right now that are looking at sleep as an outcome. And a very major, like top 10 university in the United States has significant preclinical sleep data on hydrogen,
Hmm.
that's going to be published soon. So,
Cool.
so far the evidence appears to be in line with the anecdotes we get. Our second biggest anecdote is, regarding people just feel more energy when they're sleep deprived or really low on energy or get off early morning plane. We published our first study on looking at hydrogen, comparing it to caffeine after 24-hour sleep deprivation last June, and they were equivalent, right? A tablet was equivalent to 100 milligrams of caffeine, but they affected different parts of the test, something called the attention network test, right? So hydrogen was better at like orienting, you know. So that was interesting. We did a follow-up clinical trial on that. That's actually submitted to peer review right now. So I have the data. It was really cool. Some really cool stuff with brain metabolism using fMRI, and looking at say like hydrogen plus placebo, caffeine plus placebo, hydrogen plus caffeine,
Hmm.
and then placebo, right?
Hmm.
So there was 4 groups in a crossover manner. And it definitely appears that hydrogen and caffeine affect different regions of the brain, and brain metabolism. And there was some cool complementary effects. So we hear that all the time, and now it's going to be backed by 2 clinical trials. A second one very well controlled. Um, Third, and I mean this is, I mean our best evidence right now is for like metabolic stuff. You know, metabolic syndrome, NAFLD, but people don't feel that right away. That takes months, right?
Sure.
Research
Right.
and lifestyle improvements. But the third, like kind of like wow factor one we hear is for hangovers. You know,
Nice.
and we actually have a really small pilot study. Um, Actually, I'm writing it with a few researchers, but it was double-blind, placebo-controlled crossover, and it was very, very well controlled because it was done on myself and my wife. Right, here's the participants with hangover scales. Everything was sealed. The placebo is super well done. Our placebo tablet gives the same amount of magnesium. It looks the same. It's that same like gray color. It like dissolves the same and releases CO2 instead of hydrogen. And then on top of that, just in case there's a slight difference that maybe I can subconsciously see, but not consciously, they're wrapped in tinfoil. So, when it unravels, you can't even see the tablet drop. And there were 2 tablespoons of lemon juice added, so all we could taste was the lemon.
Huh.
We couldn't taste the slight differences between the hydrogen water and the carbonated water.
Nice.
But incredibly strong results in hangover,
Wow.
in our high alcohol group. Um, and some responses in our ordering down, whether we had hydrogen or not. There were clear differences. And that was a long study. That was over 18 drinking sessions, controlled alcohol and time. So even though it was just 2 people, it was a lot of,
Sure. Cool. He self-volunteered for that one, huh?
yeah, well, I mean,
Yeah, you got to do. You get for science. You got to do what you got to do.
well, and one of the things too is it's hard to get researchers to do something that has no evidence, right? And to properly do a hangover study might cost 100,000, 200,000,
Right.
dollars. Like if I get researchers on board and like cover all the expenses to do it. So
Right.
I really want to see. I'm like, you know what? I think it works. We hear it every day. Like,
Yeah.
wow, this stuff works for hangovers. We hear it all the time,
Yeah.
but we had no evidence, right?
Yeah.
So that's why it was the first little pilot. My wife really didn't like that study because I controlled the exact amount, like to the milliliter, that she could drink every week for 18 weeks, and we weren't allowed to sip of alcohol any day but the assigned drinking day because we had big washout periods and all that stuff. So she
Interesting.
said never again, but
That's
we got
cool.
some good data out of it.
Oh, that's fantastic. Oh, Alex, this has been such a cool conversation, man. We covered a wide swath. I want to try it. I want to try it. By now we'll have, I will have mentioned the special offer and so forth, but, I'll make sure to cover that previously to this portion of the episode, but, I can't wait to try it. I'm excited to. I've got a couple of things I'm working on. Um, yeah, I hope this is the beginning of a more conversations like these, because I like the way that you approach thinking and research, and it's obviously you're innovating on a whole bunch of levels. Where can people find you personally? Where can they find your products before I ask the final question?
Yeah, so our website is drinkhrw.com, right? So drink, then HRW for hydrogen rich water.com. It's the same thing on like Instagram is at DrinkHRW, right? You can check us out on Instagram. We've got something like 40 or 50 pro athletes that endorse us now. Again, it was kind of the same thing. We have the same truth and transparency policy. We won't do a deal with the pro athlete unless they've been taking our product and can jump on the phone with us and explain the benefits they're seeing.
Hmm.
So that's one of the big things that I don't like in information. It is kind of the influencer model that, we get 5, 10 solicitations a day
Sure.
from athletes and influencers saying, these are my rates. Would you like me to post about your product?
Yeah.
And to me, that I just don't like that at all. So we've developed some good relationships with a handful of athletes, starting with ones that I knew personally
Cool.
from days I was training a lot more. And then actually it's just got spread like wildfire through word of mouth. They started telling their teammates, their friends, and now we have all these pro athletes endorsing us. And of course, it's not perfect. Maybe they make up, they tell us what we want to hear, but we're doing our best to say, try the product for at least a month or two.
Yeah.
Give us honest feedback. We only want to work with people who are taking it and seeing a benefit.
Yeah. That's awesome. I love it. Okay, well, before we wrap up, I saved the last question. It's a fill in the blank question. It can be based on anything and everything that you know. It doesn't have to be specific to hydrogen enriched water, and you can elaborate as much or as little as you want. Please fill in the blank. Everyone would benefit from knowing.
I mean, I'd say how to think, right? Because I think it's one of the biggest faults with our education is we're taught how to memorize things, but we're never really taught how to think, right? And I think proper analytical and critical thinking starts with being critical of yourself and your own actions, right? You know, we shouldn't criticize others. We should first be thinking about how we think, how we came to our conclusions. Um, People we tend to react to something based on instinct and emotion, and then use our cognitive abilities to justify why we've had that initial reaction. So I think that's the key to solving a lot of the issues with the planet is teaching people how to think.
Awesome. That is definitely one of the more unique answers we've gotten, and I've done this hundreds of times. So that's so cool. Alex Tarnava, thank you so much for joining me today on the Optimal Performance Podcast.
Thanks again for having me.
Awesome. That was great.
I tend to go off on tangents.